Hi, my name is David Canis. I'm a general dentist practicing in California. And I'd like to introduce you to a little product that we developed in our office. It's called the Dentapop Dry Field Aspirator. It's a very simple little device. It has three parts to it. It has a tongue deflector, has a mouth prop, and a built-in aspirating system. The mouth prop slides back and forth so it'll fit any size mouth. The deflector turns over so it'll fit either the left or the right side of the mouth. What we'd like to do is to show you a few ways that we use it and actually how you can hook it up in your office and start using it right away. There's nothing else for you to buy. You just use either your low vac or your high vac system, and actually the patient becomes their own assistant for most of the procedures that you do. So thank you for watching the tape.
Okay, here we can see the typical three-piece part of the Dentapop: aspirator, tongue deflector, and the mouth prop. Keep the mouth prop in the same orientation. Rotate the deflector ends 180 degrees and you have a left or right universal device. The mouth prop slides on the aspirator, allowing it to fit any size mouth. Here we see a close-up of the deflector and the aspirator relationship. That's a closed, completely closed position. That's at 4 millimeters open, which is basically your best suction. You open it up all the way to where the notch stops the deflector from coming off. You're actually not creating any vacuum, like in this position right here. You're not going to get too much vacuum right there. It is an adjustable aspirator, so you can adjust the vacuum to where you want it to be. But actually the 4 millimeter right here is about the best spot. I'd like to go into connecting up the Dentapop system. The disposable Dentapop on the right is connected to the small 3-inch flexible tubing. It's connected up to the 30-inch tubing, which goes to the mouth. 30-inch tubing is cleanable by using evac solution. High vac adapter comes with the kit, connected up with the high vac or low vac system. As we go on, we'll see how we can use it for clinical applications. For instance, if we have a tongue that is very large and impinging, we notice that we want to work on the lower molars. It's no problem with the Dentapop. Simply have the patient lift their tongue up, place the smooth side of the Dentapop underneath the lingual portion of the tongue, and retract. This is a cross-arch device in which the bite tube is on one side of the mouth and the deflector is on the other side of the mouth, like in this picture. For instance, stabilize the bite tube on one side, retract the tongue on the other side. First of all, we're going to look at forehand dentistry the way we normally see it in the mouth. Typically, we see retraction and suction by the assistant and the dentist working on the other side of the mouth. I'm going to change things around a little bit and have the dentist on one side and the Dentapop on the other side. Now you can see where the tongue is retracted, suction is taking place. Teeth can be isolated, kept very dry using the Dentapop. Place a cotton roll in the buccal. Or if you want to rinse, just rinse. Go right into the deflector and out through the aspirating system. So you can either have it very dry or you can remove liquids or debris very easily with the Dentapop. In this case, we're going to be doing a direct composite. Notice that the working area of the tooth is kept extremely dry without a rubber dam. The patient is comfortable because they're biting on a bite prop, helping them keep their mouth open. Just light cure, incremental, and we're done. This is just a picture to show you the ease in which the Dentapop can be placed. Just takes about 1 or 2 seconds. Simply retract the tongue, place the bite tube over the bicuspids on the opposite side of the mouth, and away you go. You can rinse wherever you need to do. Start your prep. Leave the Dentapop in there when you're doing your prep. Here we're seeing ultrasonic scaling using the Dentapop. The ultrasonic scaler can be used on one side of the mouth. It takes about a second to place the Dentapop on the other side of the mouth, and you continue scaling. Scale either upper or lower arch. Gravity pulls the fluids down, and the suction takes it out of the mouth. Very easy device to use. We're going to continue to kind of show you how to work with the Dentapop when it comes to ultrasonic scaling, heavy calculus, very easily removed. Calculus normally goes right up and out of the aspirating system very easily. You'll notice that the tongue is retracted back and the mouth mirror can easily get in there and allow you to see what you're doing a little bit better. Makes it better access for hygiene. Easier to work around than the ordinary saliva ejectors. May take a little getting used to, but it's a very easy device to use. Just takes about 1 second to place from one side of the mouth to the next. Patients like it because they can rest their teeth on it and relax their mouth. One of the things that you'll notice, maybe not so much in this picture, but in other situations, is the mouth mirror doesn't fog up. It acts as a defogger. The Dentapop acts as a defogger. This is an interesting patient who came in on a Saturday. He was on aspirin for a couple of weeks. He had a cracked tooth syndrome. What we'd like to show you is the difficulty that we had even finding the tooth. It was a very difficult patient with a strong muscular tongue. Using a clear tubing so that you can see the water going up this direction, we're going to go ahead and start preparing this tooth. Normally we would have the white aspirating tube, but in this situation we're going to just go ahead and use a clear tube so you can see the vacuum. We'll go ahead and get started. And we're just showing the placement of the Dentapop over the bicuspid, retracting the tongue back. Very easy to place. Doesn't take any longer than what you saw here in the picture. One of the things that you'll notice is there's no cotton rolls in here. There's no other mirrors in here retracting. There's no other suction tubes in here. The Dentapop not only retracts the tongue, but it acts as an infection control device because there's no cotton rolls to throw away after you get done. Normally, the amount of cotton rolls that would be necessary in a case like this would be several. And in this case, we didn't use any. We allowed the Dentapop to do it all. As you can see, the blood goes directly from the area directly into the system itself. You can take care of as much water as you want to place in the mouth, either from a handpiece or a 3-ray syringe. When you're taking impressions, leave the Dentapop in the mouth. You can create a real dry area just by using some air. Remove a bit of the impression material. Creates a really nice environment to take an impression. Leave the Dentapop in, place the bite tray on the upper arch, just like this. Remove the Dentapop. Oh yes, before I forget, don't forget to use your Dentapops for sealants.
Tooth right here, and we're going to put a cotton roll in the Dentapop so that he doesn't feel that area right there. Okay. Josh has a missing tooth here, so we're going to take a piece of cotton off of a cotton roll, and we're going to place it right inside the end of the bite tube. Just like that. And that'll be more comfortable when he bites down on the bite tube. Okay, we're going to be using the low vac, and you have the control very close to the mouth, so you have on and off suction, which makes it handy when you're doing sealants. Lift your tongue up a little bit. There you go. I'm going to place it. And can you bite down? Great. Okay. And then we're going to rinse the etchant off into the deflector. Doing okay, Josh? Good. That's good. Then I'm going to cut down on the vacuum again a little bit. Like that. I'm going to brush on the sealant. It's all in the grooves. Keeping the tooth dry. Make sure you cut down on the suction so you don't pull the sealant off. And then we'll light cure. With the cotton roll in the end of the bite tube, he's able to bite against his gum. Stabilize it with a cotton roll on the bottom, like that.